2018 Nipah virus outbreak. This presentation will review the international response to the Nipah virus outbreak in India and the proposed recommendations to prepare for future outbreaks based on the lesson learned. Nipah virus is a highly infectious RNA virus belonging to the family Paramyxoviridae. There are two Nipah virus clades has been reported, B genotype in Bangladesh and the M genotype in Malaysia. According to the study, fruit bites to Tarapace genus are the nature reservoir of Nipah virus. Nipah virus was first detected in Malaysia in 1998. During the outbreak, 283 human cases of acute encephalitis were diagnosed with 109 deaths. However, 2 years later, persistent and sporadic outbreaks has been reported from villages in Bangladesh and the 2 outbreaks in India since 2001. In 2018, a Nipah virus disease outbreak was reported from Kerala, India. There has been 21 deaths and 23 cases. Let's look at the timeline of a Nipah virus outbreak that occurred in India in 2018. The index case is a 20-year-old man. On 2nd May 2018, he started having fever, headache, drowsiness, and respiratory symptoms. On 3rd May, he was admitted to Hospital 1 and he was transferred to Hospital 2 on 5th May. Once in Hospital 2, he died from the disease on the same day. In the outbreak, only the index case was infected in the community. All remaining cases was due to nosocomial transmission in 3 different hospitals. The human-to-human transmission rate was very high. The index case spread the virus to 19 contacts, while another 3 cases were secondary. The index case started symptoms on 2nd May. A respiratory swab was collected, but the Nipah virus was identified by the laboratory after 17 May 2018. Due to the delay in the identification and the clear diagnosis, impeded efforts to contain the disease. After that, a rapid response team led by the Indian government was in response to the outbreak. WHO is providing technical support to the government. On 20th May, the official announcement of Nipah virus outbreak commenced. In 2018, WHO declared Nipah virus infection as one of the 10 priority diseases in the WHO Research and Development Blueprint of 2018. So, is Nipah virus disease is a historical outbreak of global health importance? Yes, Nipah virus disease is a historical outbreak of global health importance. From one health approach, we can see the potential host of Nipah virus and the transmission mechanism. The virus is spread by secretion or excretion from flying fox, infected animal or humans. Animal may get the virus if they consume fruits contaminated by the virus. Then the human has a close contact with the infected animal or consume raw or undercooked meat from such animals. Therefore, Nipah virus infection can be transmitted directly to the patient. Humans also acquire virus from consuming raw dead palm sap contaminated by the secretion. From human-to-human transmission, family members and the caregivers of a sick patient may get the Nipah virus from close contact with bodily fluid or excretion. Nipah virus is a potential threat to global health security. Firstly, the outbreak emphasized the importance of one health approach by highlighting the symbiotic relationship between human, animal, and the environment. The interdisciplinary One Health approach provides a framework for examining and dealing with emerging zoonotic disease, such as Nipah virus by engaging professionals from many disciplines, such as human, veterinary, and environmental health, as well as social science. The implementation and the development of One Health collaborations at a global scale are critical to reduce the threats of emerging viruses. The international response will be critiqued use the emergency response framework. As WHO serves as the custodian of the international health regulation, it manages global public health security against threats from infectious diseases. The ERF encompassed several crucial elements, including early detection, accurate surveillance, effective and open communication, and the improvement of infection control protocol, resulting in the containment of 2018 Nipah virus outbreak. The outbreak was a major event with a very high fatality rate. The primary case could have been infected by an accidental spillover. However, the initial spillover event may have been amplified by person-to-person transmission in the hospital settings, as subsequent cases was either close family contact or hospital contacts. For this outbreak, there were technical shortcomings compounded by inadequate surveillance systems in the epidemiology and the data analysis, the lack of an enhanced virus laboratory in the States. The delay in identification and accurate case definition resulted in deterred containment efforts such as surveillance, contact tracing, quarantine and isolation, and public education. Ultimately, this caused the spread of Nipah virus. Total of 21 deaths with a 91% high fatality rate. In the absence of a clear primary source of infection, many unscientific and misleading reports through social media on the possible source of infection created fear in the community. Due to the fear generated by the rumor, people started vacating their homes, which caused economic loss. After the emergence of a Nipah virus case in Kerala, a multidisciplinary team was deputed to review and respond to the situation of the outbreak. The multidisciplinary team was led by the director of the National Center for Disease Control, including microbiologists, infectious disease physician, the Indian Institute of Medical Sciences, the Department of Animal Husbandry. The collaboration helped in understanding the importance of One Health approach and the streamlined response, utilizing existing surveillance system. This was of utmost help in the future outbreak. From One Health perspective, the outbreak demonstrates that zoonotic virus could occur unexpectedly and risk the health, well-being, and the economics at a global scale. It also demonstrates that there was a need to having surveillance strengthening and enhanced laboratory system for early detection, and one source of truth from a government and the media. Finally, it also demonstrates that large-scale outbreaks require international collaboration and cooperation during public health emergencies, especially of zoonotic diseases. Next, I will share the recommendations from the lesson learned from Nipah virus outbreak in 2018. The Kerala Nipah virus underscored the needs to encourage annual preparative work and the public education before the traditional Nipah seasons. There are also other containment efforts to deploy when tracking such outbreaks. This includes detection of index case, surveillance activities and contact tracing, placing suspect cases into quarantine, promptly isolating confirmed cases, strict infection prevention and control measures among the hospital personnel that include hand hygiene and the appropriate personal protective equipment wearing, regular update and education to the public. The last but not the least, treatment-related follow-ups and use the monoclonal antibiotics protocols. When Nipah virus infections are suspected, droplet and contact precautions and infection control practices must be promptly in place to avoid spillover in healthcare settings. Further, given the emerging Nipah virus infection in the last decades, countryside strengthening of existing surveillance system and the multiple disciplinary response mechanisms are necessary to enable rapid detection of rare zoonotic diseases, as is the appropriate control measures with One Health strategy. In conclude, Nipah virus is a historical outbreak of global health importance, as it underscores the critical implementation of One Health approach and the early detection and the diagnosing of emerging zoonotic virus following the international health regulation. The review also shows that the Indian local response actions was in a clear contradiction to the international health regulations, the emergency response framework, and the One Health approach, which all emphasize the importance of early diagnosis and the detection, open communication, and the response in controlling global health emergencies. Based on the lesson learned from 2018 Nipah virus outbreak, key recommendations for future responses such as timely identification and the diagnosis, surveillance, contact tracing, quarantine, isolation, strict infection prevention and control measures, and the public education are the key to the success containment of a pandemic. Below is my references. Thank you for listening.